computer. All right. Okay, I think we can get started here. It's 2 minutes past 4. Oh yeah, I think we're all set here. All right. So hello, everyone. Welcome to our live Q&A session on the topic hypertension and diabetes. Firstly, just some quick introductions. My name is Pranam Shetty. I'm the founder and CEO of Evolve Medical Systems, the owner of the apps SmartBP and Glucobite, and we are based in Minneapolis, Minnesota. If you are not familiar with SmartBP, it's a blood pressure management app that helps people manage their blood pressure, and Glucobite is a mobile app that helps people manage their diabetes. Both SmartBP and Glucobite is free, and SmartBP is available in the Apple App Store and Google Play Store, while Glucobite is only available in the Apple App Store. Today, we have a very special guest with us, Dr. Omar Baqal. He is a resident physician at Mayo. And Dr. Baqal, can you introduce yourself and tell us a little more about your research interests?
Of course. Thanks, Pranam. Hello, everyone. My name is Dr. Omar Baqal. I'm the resident physicians in internal medicine at the Mayo Clinic campus in Arizona. And I have a particular interest in cardiology and cardiovascular health and public health, patient safety. These are some of the areas of interest I pursue through research, through academics. And in my free time, I work with a lot of med students, a lot of them being foreign medical graduates, those who are pursuing medical training here in the US and elsewhere, and just helping them to, navigate those hoops of medical training. And it's great being here with Pranam today, and we look forward to a great conversation.
Thank you for the introduction, Dr. Baqal. Before we get started, any health-related information provided here is for informational purposes only and should not be used to replace the advice of your doctor. So let's start off with a general question for you, Dr. Baqal. What is hypertension and diabetes? What are the risks associated with them?
I think that's a good question to start the discussion with. And before I begin, I do want to mention that all views are my own. They don't reflect those of my employer. And as Pranam mentioned, any information here is meant to be a gateway, a conversation starter for you all to discuss with your primary care physician about your options, about how to manage your condition and so on. So when we talk about hypertension and diabetes, hypertension generally is the term we use for high blood pressure in the body. And every year, the American Heart Association and other associations involved in the care of hypertension, they kind of review guidelines. They determine the criteria of what is defined as hypertension. So the numbers, can change occasionally, but to diagnose someone with hypertension, they would have to have elevated high blood pressure readings over a few visits. Hypertension is not something that's diagnosed in one visit. And we always recommend patients to measure their blood pressure after sitting for a few minutes, relaxing, and then measuring. Because when we run, when we walk, when we're doing things, when we're busy, our blood pressure goes up naturally. But that doesn't mean that we have hypertension. So hypertension definitely is a diagnosis, and a diagnosis that takes some time to establish. It is not slapped around, without proper evaluation. And when we talk about blood flow through our body, and blood flows to all our organs, and if the blood pressure is high, you can imagine how that can possibly impact and damage organs, because when the organs are constantly exposed to this high blood pressure, they try to adapt in some way to these high abnormal pressures, and that can impact their function. So that is hypertension. For diabetes or diabetes mellitus, we obviously have type 1 and type 2. Diabetes is a state of the body where it is not able to regulate blood pressure or blood glucose levels in the blood properly. And that generally happens in type 1 diabetes, where there's absolutely very limited or no insulin. In type 2, there is a bodily resistance to insulin, where the insulin doesn't work as well. And what insulin does is essentially drive the glucose into our cells. And if there's low insulin in a body, it would mean that the blood glucose levels will rise. And again, just like high blood pressures, high blood glucose levels don't do any favors to organs. They can cause damage. They can cause damage to our vessels, and in our vessels, they can increase the risk of plaque formation or atherosclerosis. And together, hypertension and diabetes basically increase the risk of heart-related disease and vascular disease.
Oh, yeah, thanks for sharing this with us. As you mentioned, there are serious risks associated, especially if you don't take care of this condition early on, right? Uh, are hypertension and diabetes related? Like, can one cause the another? Like, for example, are there any common factors associated with them where people are more predisposed than others, like obesity or family history?
It's a good question, Pranam, and I would say there certainly has been seen a pretty close association of hypertension and diabetes. And there have been studies done where, for example, they looked at patients in different tertiles of blood glucose levels, and they saw that those patients in the higher tertiles had a higher prevalence of hypertension as well. And they somewhat seem to act synergistically, to be honest. Both contribute to cardiovascular disease. And as I mentioned, flowing through the blood vessels try to adapt, they can thicken, there's plaque formation. And when you think about plaque formation, atherosclerosis, when this happens in the vessels flowing to the brain, they can cause stroke. When that happens to the coronary arteries or vessels of the heart that supply the heart, they can cause heart attacks, heart disease. When this happens in our peripheral vessels, like in our legs, that can cause peripheral vascular disease and ulcer formation and so on. So certainly, there have been studies done which indicate that they both, when found together, increase the risk of cardiovascular disease up to 2 to 4 times. When talking about risk factors, you mentioned a few, and several of the lifestyle habits that people may pursue do contribute to the risk of developing those conditions. Obesity, smoking, food intake, which is high sugar food intake, high sodium can increase, obviously, hypertension. And family history is generally always, something we take pretty seriously in any patient that comes to us. And, having a family history generally predisposes anyone to having a higher risk of developing diseases. Obviously, there are so many factors, so many variables, and it is not 100% that someone with the family history will develop a condition, but it's something that's taken very seriously when we advise patients with regards to how to control their conditions.
Hmm. Yeah, recognizing these factors early on can have a significant impact, looks like. What are some things we can do to manage diabetes and hypertension? How can we triumph over these disease states?
As you mentioned, early recognition and management is very important. And we see that with some patients who may not be as compliant with their treatment because, diabetes, hypertension sometimes may not cause any acute or sudden symptoms or an impact. And that's why people feel like, I don't really need to track my condition. I don't need to manage it properly. But truly, with those conditions, the damage is long term. As the body chronically is exposed to those high levels of pressure, glucose, and over time there's progressive gradual damage to the organs. And that's why a lot of patients with hypertension, with diabetes, develop something we call, let's say, hypertensive nephropathy or diabetic nephropathy, which is kidney disease and heart disease and so on. And these things often manifest later, years down the disease, unless the diseases are uncontrolled, where you have super high glucose level, you have a very high blood pressure, uncontrolled blood pressure readings. These can cause more emergent or urgent manifestations. So when we talk about how do we control this, obviously early recognition is important. So following with your primary care physician for your annual exams, so they can keep track of your blood pressure, that is going to be important. Very often, a lot of the management for those chronic conditions starts with lifestyle modifications. And that basically includes vigorous, regular exercise. The WHO says that at least 30 minutes of vigorous exercise, at least 5 days a week, is a good kind of guide to go by. Obviously, some people do far more than that, which is great. Dietary modifications is very important. Again, when we talk about diabetes, making sure the carbohydrates that we're eating, there is a certain restriction to that. For hypertension, sodium, cutting down on sodium can help better control blood pressure. Weight loss has incredible benefits, and that obviously goes with exercise. Weight loss has shown to improve blood pressure control, and it has shown to improve the body's sensitivity to insulin, which means insulin acts better uh, with weight loss, basically. So weight loss is going to be a goal to achieve with regards to management of those conditions. And then obviously, when we feel like lifestyle modifications aren't succeeding, we're not achieving good control with lifestyle modifications, that's when we think of managing with medications. Honestly, if we could, we would want to avoid medications as much as we would want. Some of them have side effects, they come at a cost and so on, but if things are not controlled with lifestyle modifications, it eventually leads to medications. And again, we've come so far in management of those chronic conditions, with diabetes, hypertension, the medications on the market, and we're learning more and more about those medications. And that's going to be an important discussion to be had with your primary care physician. They will probably look at your clinical profile. If you have any other comorbidities that may influence the decision, they will look at your preferences. Obviously, cost is a very reasonable preference to consider for patients. And then a side effect profile. Some medications have some side effects, some others may have different side effects, and sometimes side effects actually work in the patient's favor. For example, a class of anti-diabetic medications, we call them GLP-1 inhibitors. They cause weight loss, and someone who may be obese or might be struggling to lose weight, that might act as a benefit. And we have different classes of medications. Metformin, for example, for diabetes, a very well-known medication, but sometimes when patients start on it, it may cause some abdominal discomfort like diarrhea and so on. So these are the side effects that the primary care physician would discuss with you, so you understand and what to expect, and eventually make a decision according to that. And obviously, regular tracking of your disease will be important. Just making sure things are on track, you're responding to management, that there are no adjustments needed for your medications, and just keeping track of things and numbers.
Yeah, wow. Thank you so much for elaborating further on the relation between hypertension and diabetes. It's indeed reassuring that we can take some steps like diet, exercise, tracking, staying on top of our numbers to reduce the influence of these disease states. That brings us to the end of our session. Are there any questions from our audience for Dr. Baqal? Let's see here. Sure, if I can view the questions. Looks like there's a session here. Let's see. Looks like there's a session. Yeah, I don't see any questions yet.
Okay. Do you have any questions, Pranam?
Actually, yeah. I mean, oh, I think there's a video lag. Okay, I got to exit from this because I think the Zoom call is getting lagged here.
I see.
Okay, can you still hear me?
Yeah.
All right. Yeah. One of the things I was thinking about is the comorbidities, right? Like 2 to 4 times. Like when do you really see this onset? Like for age, right? When it comes to age, do you see like hypertension and diabetes being starting off usually at a certain age before based on age? Like, is there an onset like where both of them at the same time happen or something like that?
It's a good question. I think that leads us to a deeper discussion into the causes of diabetes and hypertension, because the hypertension we've been discussing here in this conversation is essential hypertension, which essentially comes with age. But there are many other causes of hypertension which can occur much earlier in life. And these can occur because of abnormal hormones in the body. It can occur because of tumors that secrete certain hormones like pheochromocytoma. It releases substances that that cause a pretty significant increase in blood pressure. But in that case, blood pressure increase is usually episodic. It's not like essential hypertension. So hypertension generally, and when we speak about essential hypertension, it happens usually later in life, 40s, 50s onwards. Some people may develop it earlier. When we talk about diabetes, again, it depends on whether we're talking about type 1 diabetes or type 2 diabetes. Type 1 diabetes usually happens much earlier in life. We have small kids, young kids, children with type 1 diabetes on insulin. Because in type 1 diabetes, the mechanism is that there is an autoimmune destruction of the insulin producing cells in the pancreas. And that's why there's essentially little to none insulin in the body. So they need insulin right away. Type 2 diabetes usually happens, over time with age. And again, depending on what the family history is like, it may happen a bit earlier than later. But again, usually we see that middle age onwards. But you'd be surprised. I think we've seen with a lot of diseases an earlier onset. We're seeing that, whether that is because of just environmental exposure, whether that's because of our changing lifestyle habits. But there certainly is a concern with how much of an earlier onset we're seeing with conditions. And again, as I said, people can develop one but not the other. They can have both depending on the family history. But certainly the management of one will help the management of other and prevent things from kind of getting worse.
That's very interesting. You mentioned about like even the medications, right? Like you take a medication for one, it has a side effect.
Yeah.
Well, there's like two sides of it, right? It has a side effect, and it can also help benefit, in that sense. But then at the same time, uh, it's like you take one of those meds and you could probably address an issue with the other condition.
Absolutely. Yeah. And we see that very frequently in medicine, and that is, when we're looking at medications, quite often the conversation focuses on the side effects with the patient. Depending on what the side effects are like for those different medications, accordingly, we help patients make that decision as to what medication would be best for them. So side effects sometimes can work in our favor, with regards to managing a totally different condition. And that happens with a lot of the medications out there. Again, it's just a matter of discussing your options with your physician and seeing what works best for you.
I see. Yeah. Let's see. I'm just seeing if there's any other questions here. Oh, my mom has she's like, very nice information. Thanks to Doctor and you, Pranam.
Thanks for joining us.
All right. I don't see any other questions here.
Okay.
Any questions from the audience before we wrap up here? Yeah, it's just like with Facebook, it seems like the smart thing to do is actually take it on your phone, because now
Right. Yeah.
we see
Yeah.
the comments without the
Yeah.
lags and all that.
Easier.
Okay. Let's see any more comments here. Oh, see another comment that this information is quite helpful. Thank you.
Thanks for joining.
Right. I think we've hit the time here. Last call. Any questions? All right. Okay. Well, folks, thanks so much for joining us today. Looks like we're done with questions here. Dr. Baqal, it was an absolute pleasure having you here. And I hope we can bring you in for, in the future, again, to further illuminate us on topics around hypertension and diabetes. It was really nice. It was great having you here. Thanks for all the people who joined us on Facebook today, thank you so much for joining us. Hope you enjoyed this live Q&A. If you'd like to see more of these sessions, please support us by downloading our free apps, SmartBP and Glucobite, and liking us on Facebook, Instagram, subscribing to our new YouTube channel. We'll be posting this video on YouTube. We'll be posting information on future events on our social media. So, just stay in touch. Okay, have a great weekend, everyone. Thank you so much for joining. Thanks. Bye.
Thank you, Pranam. It was nice being here and we look forward to more.
Yeah.
Have a good day.
Thank you. Good.